Welcome to Local Business Spotlight, everyone. I'm Troy Thompson. Joining me today is Dr. Harris from the Vascular Institute of Chattanooga. Welcome to the show, my friend.
Thanks, Troy. Appreciate it.
Nice to meet you. Tell everyone at home a little bit about the Institute here to begin with.
Vascular Institute of Chattanooga was started about 5 years ago by Dr. Christopher Lasar. He's our senior partner. It's grown to the point where we have over 90 employees now. We have 4 surgeons and 9 nurse practitioners, and we treat the whole spectrum of vascular disease for southeastern Tennessee and the whole southeast is a region. We take patients from all over the southeast, from Alabama, Georgia, South Carolina, North Carolina, and of course southeastern Tennessee.
All right, well, let's just talk a little bit about venous disease. Now, there's varicose veins, there's spider veins, there's all different types of issues when it comes to this disease. Can we break it down a little bit?
Sure. Venous disease is most basically seen in varicose veins or spider veins, and that's a result typically of venous insufficiency. So there are valves in the veins. Veins are very, very thin-walled, unlike the arteries, whereas you feel the pulse in your artery in your wrist. That has muscle in the walls of it. The veins are very thin-walled and don't have muscles. And they have valves which prevent the blood flow from pooling back down the lower legs. And those valves can wear out in some people, and that's why you get veins that dilate. And it's a sign of aging, too. It happens over age.
But we also want people to know that it's not just aging, also a lot of pregnant women get them.
Yes, so we see it most often in females who've been pregnant. But we also see it in people who stand on their feet for long periods of time.
Of course.
And who are in working jobs in which, we see them in chefs. Chefs are very common in which we see them. Or people who work in a kitchen, or teachers who are on their feet all the time teaching.
Dr. William, you say disease.
It is a disease.
So let's just, people don't think of venous or varicose veins as a disease, because when we hear disease, we hear cancer.
Right.
We hear those serious words. How is this an actual disease?
Venous disease actually kills a tremendous number of people in the United States every single year. Deep venous insufficiency and compression of the veins can lead to deep venous thrombosis, or DVT, and DVT can lead to pulmonary embolism, which is a clot that travels up to the lungs, and it's actually the second most frequent cause of sudden death in the United States. It kills upwards of 100,000 people every single year.
That's insane, isn't it?
It's amazing. So it's sort of a silent killer because so many people walk around without ever even knowing they have such a thing, which can cause blockage of the vein, and that vein, we know that blockages of veins can cause clot formation.
If we see that we're getting a vein protruding on our leg, is that something we should come, oh my gosh, we're going to go see Dr. Harris, this could be an issue.
If it's just a vein that's bulging out, it doesn't bother you, that's not something you should ever really worry about.
Right.
But if you
What's a warning sign?
A warning sign is swelling, skin discoloration, fatigue in the leg.
Pain?
Pain, obviously.
So there's pain.
So anytime you have something like that, you should definitely see your provider, and they can get you referred to a vascular provider for further evaluation.
One question before we go. It is a treatable disease, obviously.
100%.
But there are different types of procedures depending on the issue, right?
And most of them are done in an outpatient setting in an office such as this.
Okay.
We can use, sometimes we use lasers, sometimes we actually cut out the veins, sometimes we actually have to put stents in veins to treat them. There's a whole number of new and emerging technologies too to better treat the patient in a more minimally invasive fashion.
Dr. Harris, great information. I can't wait to come back and see you again.
Anytime, and if you have veins.
Yes, exactly.
We can fix them.
We appreciate you.
Thanks, Troy.
If you want to find out more information, there it all is up on the screen for you. Vascular Institute of Chattanooga, Dr. Harris and the team over here will take care of all your needs.